r/AskReddit. Doctors of Reddit, what is your best how the hell did the patient survive story? It was my first day rounding with the surgery team, and as we approached the patient's room, one of the surgeons turned to me and said, check this out, this man has had more than 70 abdominal surgeries. We walked into the room and the first thing I noticed was that it was really homey, which is unusual for a hospital. He had some aromatherapy going on, and pictures taped to the wall. A guest cot was set up with several pillows from home, and a nice knit blanket in the corner. It was clear that he had been there a while. The patient was a somewhat overweight, probably obese, man who had indeed had more than 70 abdominal surgeries. Unfortunately, at some point the skin and fatty tissue on his abdomen had become infected and been removed. The result was a square cutout on his belly, from the nipple line to his belly button, extending across his entire stomach. It was perfectly square, with perfectly normal skin and fat around the cutout, and when he breathed, his abdominal muscles and intestines would just sort of come in and out of the abdominal cavity with each breath. He looked like something out of a zombie movie, but was apparently doing alright, and living with it. He was attached to a machine called a wound vac that kept the wound clean and provided suction to remove any fluid, or in his case, feces, that developed in the wound. We were waiting for the day when he stopped leaking stool into the square to get him a skin graft. We were still waiting when I left the surgery service a month later. I was a resident at the time. It was the end of my shift, and I walked past a guy walking to the front desk with a goddamn harpoon in his head. It came in from below the chin and got out through the top of the skull. Dude wanted to go harpoon fishing. There was an accident in the boat and he shot himself, so he turned the boat around, sailed to shore, got into his car and drove to the nearest hospital, where he parked and walked into the reception. He was completely conscious and couldn't speak for obvious reasons, but he wrote down eloquently. I heard he was sent home the very next day with no complications. The story of Mary Vincent is insane. She was a teenager and hitchhiking on the west coast of the US, got picked up by a madman who raped her repeatedly over the course of a couple hours. Eventually she fought back and grabbed onto his arms. When she wouldn't let go, he chopped her arms off with a hatchet and threw her body into a ravine. For hours she climbed 30 feet up the side of the ravine sans arms, and eventually made it to the side of the highway, naked, muddy, bloody with still bleeding stumps where her arms would be. Apparently she scared the first car off when they pulled over for her, but the second car brought her to the hospital after her 2-day-long nightmare. She's still alive like 20 years later and has 2 kids. She's a fucking badass. I had a dog brought in that had eaten a bunch of anticoagulant rat poison about a week prior. They didn't think anything of it at the time because the dog was fine immediately after. If a dog gets into anticoagulant poison and you catch it right away, you can decontaminate them and give vitamin K and they'll usually be fine. By the time they decided their dog should see the vet, it was dripping blood from every orifice, in shock, and had a packed cell count of 6%. For some reason, they'd let me hospitalize and start vitamin K, but they would not let me transfuse that dog. It was bleeding from its freaking tear ducts, too weak to lift its head, and I was so convinced it was going to bleed out in front of me if I couldn't buy it sometime with some donor blood. That stubborn little pup pulled through and was going strong when I saw her a year later for her regular checkup. Not my story but my sister's. She had an infamous drug addict in her 50s admitted for endocarditis, heart infection, who had multiple previous admissions in the same hospital. During her stay the patient went through withdrawal and had not 1 or 2, but 3 cases of Torsades D points that needed defibrillation. Where most people don't survive not even one of these arrhythmias, this patient quickly recovered and was asking not a week later to be discharged cause she was ready to party again. My story would have to be a drunk 20-something that came after being stabbed on the forehead. We worked him up in casualty and found a large amount of air that had been sucked in his skull from the open wound. Patient clearly needed neurosurgical intervention, but got impatient and decided to abscond. We searched for patient and tried contacting him, but couldn't find him. Patient returned a week later being brought in by his mother because he kept complaining of headaches. When my dad was in residency, he was helping deliver babies. One came out stillborn. It was a rough time for everyone. Dad had to carry the baby away, and the entire time he carried the body away he did chest compressions. The baby started to breathe again. Dad had to bring the baby back. By all accounts, the likelihood of that working was extremely low, as they had already done everything they were supposed to for longer than they were supposed to do it. The parents had to go through some trauma therapy after that. That's all I know about that story. In nursing school I had an elderly patient who had a Whipple surgery, very extensive abdominal surgery to resect pancreatic cancer, and must have perforated. It took 3 days of worsening redness before the order came to remove the staples. I was helping out as a stench of blood, pus and poop filled the room. The next month of clinicals included 7 times per day dressing changes, pulling yards and yards of blood and feces soaked packing out of the wound. Somehow this guy actually made it through. I have no idea how he didn't get septic. 2 stories, one from my friend, and one from myself. We are both doctors. 16-year-old boy comes into ICU with severe head trauma after being assaulted by a gang of teenagers with baseball bats. On arrival his left pupil is blown, and they send him to the OR for an emergency craniotomy. Survives that, but a couple days later his right pupil blows, and he needs a second craniotomy. Survives that too. A week later both pupils are blown. 3 craniotomies later, he's circling the drain, but somehow manages to cling to life in the ICU on every single pressor and in a trope known to man. Ended up walking out of the hospital, unaided, on his own 2 feet a couple months later, albeit with some memory issues. 50-something-year-old man, out in the middle of fucking nowhere, Australia, doing gardening in his front yard, when he experiences the worst headache in his life, that came out of the blue. Now any medical professional would immediately have alarm bells ringing and aneurysm. However, this guy has a history of headaches, so he thinks nothing of it, and just puts some ice on it, and went to sleep. Woke up a few hours later with the headache still there. Goes to the ER at the nearest country hospital, gets a cord scan. Sure enough, he had a burst aneurysm, a subarachnoid hemorrhage, and so he was transferred to a regional center, but they didn't have the equipment to treat him either, so they flew him to our city hospital, where he was then treated. He cold died at any point, but miraculously pulled through. Last I saw him, he was up and walking with no focal neurological deficits. On the trauma service just before Christmas several years ago, get paged for incoming 911 trauma at some time near midnight. Walk out of the workroom on the top floor of the hospital and I can see several blocks away the road lit up with cop cars and ambulances. Knew it was going to be bad. 20-ish-year-old comes in, after being shot 7 times in the chest, awake, talking. Every single bullet missed every vital organ and he survived. His 16-year-old buddy gets shot just once in the chest, and dies on the scene immediately. Cops show me their body cam of the scene with them doing everything they can to save this kid, but he was too far gone. Police later caught the 2 suspects who had been doing home invasions including another murder, shooting another robbery victim in the street, and knocking over several pharmacies. Wrong place, wrong time. 16-year-old waiting for Christmas and the rest of his life, gone in an instant. Life just isn't fair. I had a friend who got 23 back drunk and stole his friend's car around 2 a.m. He went for a driveway out in the country and lost control while speeding. Hit a tree, basically broke the car in half, and rolled 5 times. He got ejected and ended up pinned under the car when it came to rest. He laid under the car for several hours until someone going to work early in the morning spotted him and phoned EMTs. After a week in a coma, he woke up and did months of physical therapy to get back to walking, and eventually made a full recovery to the point that he was squatting almost 400 lbs. Then he died of a fentanyl overdose. I'm an doc and went to see a whole patient with a complaint of toe pain. Sat down to really talk with the guy since it was a lull in my shift. Said his toe hurt because he dropped a knife on it. Asked him, were you cooking or what? He looks up from his foot and I notice a thin red line on his neck below his thyroid cartilage, Adam's apple. My heart sank, then started pounding. It's really hard to slit your own throat without bleeding to death. But not impossible if you hit the trachea just right and it lines back up when you look down. Which is what this guy had done. He had cut nearly all the way through his trachea, windpipe, and just the muscle in the back was preventing it from falling into his chest, causing him to die by suffocation. Once that happened, I wouldn't be able to help him, not with intubation, breathing tube, or cricothyroidotomy, cutting into neck, since his trachea would be retracted into his chest. Very calmly I called cardiothoracic surgery and got the guy to the still looking at his toe to maintain the seal, for a tracheal repair. He was discharged to the psych floor 3 days later, since this was a suicide attempt, but did well. I knew he had already decided to live, since we had about a half hour to calmly talk to each other waiting for the to be ready. If he wanted to finish himself off, he would have just need to look at the ceiling. Like many patients in the his story was poignant, his acuity wasn't immediately obvious, and there is morbid humor associated with the case. When we tell our trainees about this case we refer to him as the Canadian. Not a doctor, but the patient, less than a year old, started seizing. This led to a severe case of the not breathing, quickly followed by everyone shitting themselves trying to get me to breathe. 2 frantic rides to the hospitals later. First one couldn't take me because they didn't have machines for someone so small, and now they've got machines keeping me alive. Several surgeries solely reacting to more shit going wrong. A month, half of which spent in a coma, and I woke up on my own. Didn't even need the machines anymore. Only lasting effect is a small scar from a machine they left on for too long, and asthma for about 5 years. They never figured out what the hell happened. So, there's a chance that it could happen again someday. Here's hoping for the same luck that got me through it the first time. I wasn't in the hospital at the time, but a friend of mine was and this happened. A guy was high and tried to rob a girl in a bridge, but things didn't go as expected, and he tried to jump like 7 MTs down, which caused several fractures in both legs. As police and medical services were called, he tried to swallow a bladed object. BC prison didn't sound good. So there's this guy now with both legs in awful state, multiple cuts and a perforated esophagus, that fell into cardiac arrest twice. But he survived, so there's that I guess. During the night I remembered another 2 cases, maybe not as extreme, that I was present at. An 18-year had a 5 centimeters cut in the left side of his neck and part of his ear was missing. I always try to chat a bit with the patients to learn about it, and to make them a bit more comfortable. Turns out this kid had schizophrenia, and gave up trying to deal with the voices, so he stabbed himself. The other one was a guy with a pretty bad cut on his hand and my buddies, and I had to clean and stitch it. Once finished, we called the doctor in charge of us to take a look. He said it wasn't bad and then, "You guys didn't move his head at all, right?" "No, why?" Turns out he had been stabbed in the back of the head and the knife was still there. Not a doctor, but holy shit, my dad. Been shot once, stabbed once, was an extremely brittle diabetic, got pancreas transplant, survived 2 diabetic comas, was homeless for 5 years, got addicted to hard drugs, then went through rehab, end-stage renal failure, got a cadaver kidney transplant last minute, right shoulder dislocated twice, fractured hip, lost his top 40th in a mechanical bull. Mishap, no fucking joke, been through multiple miscellaneous surgeries, lost a leg to Sharkut, spelling, foot, and is almost completely blind. 10/10ths dad though, would son again. Dude's a monster. He just went on a 28-mile tandem bike ride last week and next week we are hiking through the desert to smoke weed. He now smokes a lot of weed. Not a doctor, but my mom, when she was a small child, 6 or 7, got really sick. They couldn't figure out what it was. One night, whatever the infection was, it caused an artery to rupture in her head. She started bleeding out through the ear while she was sleeping. In the morning my grandma came in to wake her up, and the bed was soaked in blood, the pillow soaked, my mom's face and upper body covered in blood, my mom herself white as a sheet. Grandma flipped her lid, thinking someone had slit my mom's throat during the night, and that my mom was dead. She called 911. Cops arrived pretty quick, thinking they were responding to a murder. Then my mom sits up in bed and asks what was going on. Scared the crap out of everyone. Medics get called and she gets airlifted to Mary Bridge. They have to give her several bags of blood in transfusion. She has to have several surgeries, is temporarily paralyzed on one half of her body. spent months in the hospital, and had to relearn how to feed herself and walk, and basically be a functional human being. She turned 62 in a little over a week, and the only remnants of her almost dying is a thin scar from ear to chin. Her eyes dilate differently, and the left side of her tongue is partially paralyzed. It might be my grandpa. My dad is a doctor, I'm not a doctor, and one day, when we were traveling with my mum's parents, we noticed my grandpa was walking poorly and depending on one leg more than the other, and also got tired very fast. Initially we thought maybe a stroke, but then he thought maybe it was a meningioma, brain tumor. Luckily as a doctor I think he helped get a brain scan for my grandpa, and they found 2 large brain tumors, one the size of a small baseball apparently, which applied a lot of pressure and was also squeezing his optic nerve or something. So eventually they operated and took out the big tumor, and he is relatively old, so he would likely not fare too well after brain surgery. They left the small one in cause they said it wouldn't be big enough to be a hindrance until he was like 103 years old, so at that point it wasn't worth the risk of taking it out. Somehow his eyesight wasn't damaged at all. He can walk perfectly again. His stamina and endurance is 5x better, and his attitude is incredibly positive at all times. I think the shock of the tumor and his gratefulness caused that, when everyone basically expected him to die after hearing about the tumor. IDK if this is actually a rare occurrence, but it sounded pretty crazy to me. I'm not a doctor, but this is a story of my late grandpa. He was crossing the road one night and got struck by a car. Police said when the car struck him the force literally knocked him out of his shoes, and that from where the shoes were on the road was 60 feet away from where he landed. He landed in the windshield of a car coming the opposite direction. No shit. He was taken to hospital and was resuscitated and in a coma with severe brain damage. Doctors told my mum he was never going to wake up, and if he did he wouldn't be able to walk or talk. Whilst in a coma he died, and was resuscitated twice more. Eventually beyond anyone's belief he woke up, and after weeks in the hospital bed he looked out the window, pointed at the cars on the road and said football. He went on to make a near full recovery, slight slurred speech, and not full movement in the left arm. Went on to live on borrowed time until the age of 80, roughly 30 years after the accident. Miss that guy. I'm an IQ nurse. Later into her recovery I took care of a young 20-something woman who was speeding down the highway drunk one evening. She crashed her car into a ditch. Of course she wasn't wearing her seatbelt either, so she was ejected from the car. Except that due to the force of her high-speed runoff and the angle of the ditch she drove into, she was ejected into a tree. She ended up getting impaled through the neck by a 6-inch circumference branch. It missed everything important by millimeters thanks to the way she was skewered. I'd have never believed the story of her arrival if I didn't see the photos from when she was first brought into our sister level 1 center. EMS has to cut her out of the tree and bring her in with the branch still running her through. She ended up trached and vented and with a feeding tube, but she did wake up again and was slowly making progress with moving her fingers again when I took care of her. Not a doctor, but I've seen this kind of thing happen in my own family. In 2015 I think, my grandfather got really sick. Don't remember exactly with what, but it had something to do with his intestines. As if this wasn't enough, he got an hospital infection. Had to go through a lot of surgeries, and before every single one of them the doctors would tell us to prepare for his death, because someone at his age just wouldn't survive this kind of procedure. After one of these surgeries, something went wrong and his intestines leaked shit into his body for almost 2 days. He survived, had to use a colostomy bag for months, but still made it. Now he proudly shows his scars to everyone he meets. And years ago, when I was around 5 or 6 years old, he was working on a construction and fell from a really high place, more than 5 meters I think, broke a few bones, but did a full recover. Not a doctor, but an IQ nurse. Had a patient who was a heavy multi-drug user, had been admitted more than a few times for problems relating to drug use, i.e. endocarditis. Always signs out AMA as soon as she can, and likely doesn't finish her antibiotics because she keeps coming back. My second time receiving this patient, she had been found in public seizing, and paramedics were called and then brought to me again. Brought her down to court after she was sedated, paralyzed, and vented. Thin giant frontal lobe abscess. Shipped her out to a neuro hospital the same day. 6 months down the road, someone from my team gets a call from the inpatient unit about this same patient. I honestly was certain I'd never see her again. Thanks for watching UpGoat Reddit. Try like and subscribe button if it still works.